I'm Dr. Louis. My friends call me Mark. This video is for you if your home stool test is positive. The title of this video is Hybrid Colon Exam 2, Emulating the Pap Smear. The Pap Smear is undoubtedly the most successful cancer prevention technique ever developed. For colon cancer prevention, first we should detect high-risk polyps. For that, we will have to use either endoscopy or radiology. By the way, if there's some cooperation between endoscopy and radiology, I believe we can match Pap Smear. We can use endoscopy. For that, we have standard colonoscopy, warm water colonoscopy, video colonoscopy, tandem colonoscopy, tandem video colonoscopy, cap-assisted colonoscopy, third eye colonoscopy. Unfortunately, all 7 of these have a miss rate of more than 10%. In addition, 11 to 12% were incomplete. If you have a high-risk polyp in the right colon, the miss rate of that polyp would be 100% for an incomplete examination. Luckily, there is another version. It's called balloon-assisted colonoscopy. There is no incomplete examination, but the miss rate is higher than standard colonoscopy. If we try X-ray, we can have a single contrast barium enema or a high voltage single contrast barium enema. The two of these are quite similar. It's lousy for the polyps. The miss rate is very, very high, but it's pretty good for detecting colon cancer. Or we can have double contrast barium enema or high density double contrast barium enema. The miss rate for high-risk polyp is quite low, but the miss rate for colon cancer is high. Or we can do both. We can do the single first, but the barium in the single will flocculate and ruin the double. Or we can do the double first. The water in the double will be absorbed and the coating will fracture, and that will ruin the single. Or we can go to CT colonography. The miss rate of that is about 10 to 11%. Or we can have CT colon with fecal tacking. The miss rate is the same, but the overcall rate is a little bit less. Or we can go to something else altogether. We can have capsule endoscopy. The miss rate is 12%. Or we can have a nuclear medicine scan. This scan cannot detect colon polyp, but it can detect colon cancer invading other tissues. Or we can have brighter lumen MRI or darker lumen MRI. The machine can be set to make the fluid inside the colon look white or make it look black. The bright version, the miss rate is about 13%. For the dark variety, the miss rate is 10 to 11%. Or we can get really fancy and have a PET MRI. The letter P stands for positron. But this technique, the mist ray, is no better than dark lumen MRI. So what is left is fluoroscopic barium enema and modified Mayo Clinic technique. Remember, the manual compression or the compression with the pedal made all the difference. Next, the polyp has to be removed. Using colonoscopy is great, provided the scope can reach the polyp or the colonoscopy can see the polyp. If not, then we have to use colotomy coloscopy. This is a little invasive. Luckily nowadays we can have laparoscopic surgery. This is only very minimally invasive. Now I'll talk about the disadvantages of X-ray. The radiation is the main concern. A colonoscopy copy the dosage of radiation for CT colon, and using his figure I can calculate one iatrogenic cancer per 4,000 CT colon. But don't forget, colonoscopy produces one iatrogenic death per 1,000 colonoscopy. Now, as far as barium enema is concerned, the single contrast is the examination of choice for bowel obstruction, so you can get it rather easily in small towns, but not in big cities. Now, talking about the advantages, there is no incomplete examination. The examination is very low discomfort. The preparation is very gentle. The recuperation time is very short. Now I'll talk about technical details. I will stay with the modified Mayo Clinic technique. Somebody that may be interested in this if he or she has a positive home stool test. Now the preparation starts a day before the examination. On that day, consume a clear liquid diet and start a laxative called Pap 3350. You can start this in the afternoon. This preparation is known to be the most gentle colon cleansing method ever developed. It's safe for patients with diabetes and for patients with electrolyte imbalance. There's often excess fluid after PAC. This makes it useless for colonoscopy, but it has no adverse effect on fluoroscopic barium enema or modified Mayo Clinic technique. If anything, it makes life a little bit easier for the radiologist. The examination itself is of very little discomfort. First, do a digital rectal examination to rule out large masses in the rectum. Then drip in barium suspension to the splenic fracture and stop. Now, just the left colon is filled, so there is very little discomfort. And under fluoroscopy, compress the left colon inch by inch in the profile projection, and also compress the sigmoid colon 90 degrees to the profile projection. Then drip in some more barium to just beyond the hepatic fracture and stop. There's no significant distension of the colon, so there is very little discomfort. Compress the right colon inch by inch in the profile projection, and also the cecum 90 degrees to the profile projection. In this projection, you should see the cecum triangular in the outline. If you see this triangular outline, it is a sure sign that the cecum has been adequately filled. It's nice to see the ileocecal valve or the appendix, but it is not essential. However, if what you thought is the cecum is semicircular in appearance, you have not filled the cecum yet. So what you can do is to add more barium or tilt the head of the X-ray table up by about 30 degrees and advance the barium by introducing some air. And you do not have to take any spot images unless you see polyp or cancer. Finally, I would also recommend to drain the rectum as much as possible, introduce some air, and do the 2 recommended views of the rectum. Then take the patient to the washroom because you have already finished. Now, the equipment for the fluoroscopic barium enema is a pair of lead gloves for the manual compression. For the modified Mayo Clinic technique, you need a pneumatic radiology compression pedal, but I prefer a homemade compression pedal. I'll talk about both. This is a radiology compression pedal. Inside the pedal there is a metal ring, and there is also a balloon. I have puffed up the balloon, and I have also attached a 1 centimeter metal bar to a piece of elastic and put it on top of the balloon. And then I'll turn this side down and use the balloon to press on the colon. This is a homemade compression pedal. This is just a spaghetti ladle. You can see I have attached a 1 centimeter metal bar to the bottom of the bowl of the ladle, and I attach a metal ring on the top of the bowl of the ladle. I have also attached a rectangular wooden bar to the handle of the ladle. The ladle should be made of very firm plastic. If it is not firm, you have to attach the wooden bar closer to the bowl, so kind of up to here. And the bowl of the ladle can be quite slippery. So what you do is tape several masking tape at the bottom of the bowl and use that to compress the colon. Thank you for watching. This is the end.